You respond to a Code 3 report of a 29-year-old male in an industrial accident. Witnesses report a window cleaner fell 3 stories when he fell off of scaffolding. That is your call. Are there any acronyms you'd like to state prior to your time starting?
DCAT BLS, deformity, contusions, abrasions, punctures, lacerations, swelling, and contusions, TIC, tenderness, instability, crepitus, BSI, body substance isolation, PINMAN, personal protective, personal partner, patient, public safety, environmental hazards, number of patients, mechanism of injury, nature of illness, additional resources needed, need for extrication or C-spine, PMSCs, pulse motor, sensory, cap refill, PMSCs, DCAT BLS, TIC, DCAT BLS, PMS, TIC. What else am I missing? Dr. Germ, deformity, guarding, rigidity, hot belly, is it hot belly? Pulsating masses.
The D in Dr. Germ is incorrect.
Eviscerations.
The D in Dr. Germ is incorrect, so you have to state it in line if you can't get it.
It's not deformity?
No.
Distension.
Correct. Okay.
Distension. DCAT. Okay, so Dr. Germ, BLS, PSI, PPE, personal protective equipment. All right. And
is that it?
Yeah, should be it.
Okay, you arrive on scene. Go ahead and start with BSI,
Okay.
PPE, PenMan.
So BSI and PPE and PenMan. And then general impression of the patient.
What are you checking for?
And BSI PenMan. Oh, general impression of the patient, age, weight, gender, position found, and life threats.
Okay, you have a 29-year-old male, approximately 90 kilograms, lying face up with no uncontrolled hemorrhage.
Okay, so 29-year-old man, 90 kilos, laying in supine position, no life-threatening hemorrhage. We're going to check AVPU, alert, verbal, painful, unresponsive.
He's not alert or tracking you.
Okay, and then, sir, can you hear me?
He's not responding.
Okay, I'm going to press for painful. Does he respond to painful stimuli?
He wakes up, he is confused, and he's groaning to pain.
Okay. Sir, my name is Kyle. I'm an EMS student. I'm going to be assessing your airway today. I'm checking for his airway, whether it's open, clear, maintainable. Is there a need for suction?
It is open but not maintainable. No need for suction.
Okay. And then I'm going to insert a airway adjunct, an OPA. I'm going to measure the OPA from the earlobe to the tip of the jaw.
Okay, patient accepts the OPA. Go ahead and continue.
Okay, then I'm going to move on to breathing. I'm going to check the rate, depth, and ease.
Fast, shallow, and labored.
Okay, I'm going to assess lung sounds and obtain SpO2 reading.
Lung sounds diminished on the left side. SpO2 reading of 88.
Okay, I'm going to initiate oxygen via a non-rebreather mask at 10 liters per minute.
Go ahead and apply it.
Liters. All right, sir, I'm going to be giving you some oxygen. I'm going to fill the bag and place the cup around the patient's nose. Going to pull and create a barrier.
He accepts the non-rebreather mask. Go ahead and continue.
I'm going to move on to circulation. I'm going to check the rate, quality, and rhythm.
Fast, regular, and weak.
Okay, I'm going to observe his skin signs for color, moisture, and temperature, and check cap refill.
Pale, diaphoretic, and cool.
Okay,
Cap
I'm
refill
going
is
to
delayed.
Cut and expose for life-threatening hemorrhages.
No uncontrolled hemorrhage.
Okay, now I move on to my first load and go. The patient is load and go based on compromised ABCs and life threat by falling, or just compromised ABCs. Patients load and go by compromised ABCs, I would decide to transport.
Okay, I acknowledge your decision. Go ahead and continue.
Okay, then I'm going to move on to the rapid trauma assessment. I'm going to start at his head. I'm going to expose and observe for DCAT BLS, and I'm going to palpate for blood on my glove and step off. And then I'm going to move down to the neck, where I observe for DCAT BLS, medical alert tags, stoma, JVD, subcutaneous emphysema, and tracheal deviation. I'm going to expose and observe the chest. I'm just palpating on the neck. I'm going to...
You can go back.
Okay. I'm going to palpate the neck for medical alert tag, stoma, JVD, tracheal deviation, subcutaneous emphysema, and blood on my glove posteriorly. Then I'm going to move on to the chest. I'm going to observe for DCAT BLS, paradoxal movement, flow segments, and sucking chest wounds. Then I'm going to palpate the chest. Palpate. Anterior to posterior and lateral to mid-lateral.
Okay, go ahead and demonstrate.
Honestly, I don't think I ever learned how to properly palpate.
No? Okay. Go ahead and we're going to continue.
Okay.
So at the chest, you discover a gunshot wound causing a sucking chest wound. Walk me through how you would treat it.
I would apply direct pressure with a bandage and try to control the bleeding while applying an occlusive dressing.
Okay, what would you monitor signs and symptoms for?
Tension pneumothorax.
What is tension pneumothorax?
Tension pneumothorax is where air gets trapped between the chest wall and the lungs, creating pressure in the chest.
Name the signs and symptoms of tension pneumothorax.
Signs and symptoms of tension pneumothorax are tachypnea, tachycardia, decreased lung sounds, decreased respiratory rate, JVD, and tracheal deviation.
Okay, back to abdomen. Go ahead and continue.
I'm going to expose and observe the abdomen for DCAT BLS and eviscerations. I'm going to palpate for Dr. Germ and a posterior to anterior and lateral to mid-axillary. I don't know. I'm not sure on that.
Go and demonstrate.
I'm going to palpate here and then check each for segments. Then I'm going to move down to the pelvic area. I'm going to expose and observe. I'm going to expose and observe for priapism, vagina discharge, incontinence. Priapism, vagina discharge, and incontinence. And I'm going to palpate the pelvis for offset pressure bilaterally for drawing a blank on this one. So I'm just going to demonstrate palpating. And then after the pelvis, I'm going to move down to the lower extremities, where I will observe for DCAT BLS and palpate for offset pressure and tick, and assess PMSCs. Then from the lower extremities, I will move to the upper extremities and observe for DCAT BLS and palpate for offset pressure and tick and assess PMSCs.
Your PMSCs are intact. Go ahead and continue.
And then from upper extremities, I will prepare the patient for backboarding. Oh no, I'm missing a whole section of vital signs and delegating my partner for manual C signs. Wow, it's all coming back to me and I just realized how much I missed. Hi, future Kyle, do better.